Hey ladies and gents, let's take a look at our nice big 3D heart model here. So let's orient ourselves. What we're looking at is the anterior portion of the heart. So technically this would be the left side of the heart and this would be the right side of the heart. As we look at some of the external anatomy, always make sure you can find the apex, which is the pointed portion of the heart. Then we have some of our larger blood vessels like our pulmonary trunk, which comes up out of our right side of the heart from the right ventricle, and then divides, remember, into our left and right pulmonary arteries to bring deoxygenated blood to the lungs. Over here, we can see our little portion of the ascending aorta as it makes its turn into the aortic arch itself. Now remember, the aortic arch essentially distributes the oxygenated blood from the left side of the heart to the rest of the body. Some of the other important pieces of anatomy on the exterior portion of the heart, this would be, once again, our left ventricle, this would be our right ventricle. We can see our atria with their auricles. So this would be our left atrium, and the auricle itself is kind of a pouch-like extension of the atrium, kind of along the inferior edge of the atrium itself. It just gives the atria a little bit more volume. We have the same thing on the left atrium. You can actually see the pouch a little bit better here with the auricle itself. So remember, the auricle are pouch-like extensions of the atria. As we look at some of the blood vessels, well, between the left and right ventricles, you can see there's this big groove. That's called the anterior interventricular sulcus, or sulcus, which you have one on the back too, it's just you can't see it so well on the model that we're looking at right now. I'll show it to you on another model a little bit later. Running down through this sulcus are some of our important arteries and veins of our coronary circulation. Now remember, our coronary circulation brings oxygenated blood directly to the heart muscle and then picks it up and sends it back to the right side of the heart. So some of the important arteries you'll see, we can see our circumflex artery that goes directly under the left auricle here. Branching off of that, we also have our anterior interventricular coronary artery or cardiac artery. And then right next to that is its corresponding vein, which is our great cardiac vein. As we move to the right portion of the heart, you can see some anterior cardiac veins. And then over here on the right side, along the margin of the heart, we have the marginal artery in red, and then this would be essentially corresponding with the small cardiac vein as well, which runs right alongside of the marginal artery. If we look around toward the back of the heart, or the posterior aspect, this is actually what's considered to be the base of the heart, where it essentially attaches to the respiratory system and the large arteries and things like that. Coming into the posterior aspect of the heart, we have our superior vena cava here, and then our inferior vena cava here going into our right atrium. And then we have our right pulmonary veins, which bring oxygenated blood back from the lungs to the left side of the heart, directly into our left atrium. And here's actually our left pulmonary veins. All right, let's take a look inside at this point. So we're going to open up our heart, and we're going to look at some of our internal anatomy. So the first thing you'll notice is that the heart itself has 4 chambers. It has 2 atria and 2 ventricles. So this would be our right atrium and right ventricle, followed by our left atrium and left ventricle. Remember, the atria are the receiving chambers of the heart, receiving blood. If it's the right side, it's receiving blood from the systemic circulation, essentially deoxygenated blood from the rest of the body. In the right atrium particularly, you'll notice these ridges of muscle. These are called the pectinate muscles. They are found in both atria, but in the left atria, they're really only found in the pouch of the auricle itself. They're much more noticeable in the right atrium, and you can see the right atrium itself. Now, from the right atrium, the deoxygenated blood passes through into our left atrium, or sorry, left ventricle, through a valve. And this is actually the tricuspid valve or the left atrioventricular valve. Now you notice attached to the valve itself are these kind of string-like structures, and these are called chordae tendineae. The chordae tendineae are quite literally the heartstrings that old folks used to say, "You're tugging on my heartstrings if you're making me feel bad about something." But what they do is they actually attach to muscles, and these specific muscles are called papillary muscles. And you can see in number 68, that is actually a papillary muscle. You can see that a little bit better over here with number 69, the two kind of very finger-like papillary muscles. They essentially attach to the chordae tendineae and allow the chordae tendineae to brace the valves during ventricular contraction to prevent blood from essentially reversing the valve into the atria to prevent backflow of blood. Now, also in the walls of the ventricles, you'll notice these kind of ridges of muscle that are not papillary muscles. These are called trabeculae carnae, just the specific name. Now, from our right ventricle, the blood will actually be pumped through this valve right here, which is our pulmonary semilunar valve, up into our pulmonary trunk, which is what we see here. Now, blood will return to the heart from the lungs after heading out through the pulmonary circulation into our left atrium. Now, if you look into our left atrium at number 92, you'll notice kind of a little depression. And that depression is what's called the fossa ovalis, and it's what's left of part of the fetal circulation. Originally, there was a hole there during your fetal development that allows blood to bypass the pulmonary circulation. Why? Because you don't really need your pulmonary circulation at that point. It's just kind of extra space for the blood to be pumped through for no purpose because you're not breathing at that point. You're getting all of your oxygen from mom. So originally that's a hole, but that closes just prior to birth to form this kind of grooved indentation between the left and right atria, which is called the fossa ovalis. Now, as the oxygenated blood is returning from the lungs through the pulmonary veins, is received by our left atrium. It passes through our bicuspid or mitral or left atrioventricular valve. Mostly you're going to hear it referred to as the mitral valve or the bicuspid valve in practice, though. Once again, attached to its own chordae tendineae. From there, it's going to get pumped through our aortic valve and up into our aorta. So if you want to get a good view, so you can actually see, this is the aortic valve here. This would be our pulmonary semilunar valve. And if we close this up, we can see how we have our aorta right here. So once again, aortic valve, pulmonary semilunar valve. That's what we see here. One of the things you'll notice in the heart model and on actually our actual heart dissection is that the left ventricle is much thicker and more muscular than the right, mainly because it has to pump blood throughout your entire body as compared to your right ventricle, which only has to pump it really right next door to the lungs. So that's, one last thing that I forgot to mention. There is on your study guide something called the moderator band. The only place you will see the moderator band is on this model. It's actually number 63 here. It's part of your heart's intrinsic conduction system, and it sends the signal to contract to the papillary muscles before it goes to the rest of the myocardium and the ventricles. And it does this to make sure that those valves are braced by the contraction of the papillary muscles pulling on the chordae tendineae so that the valves will not reverse into the atria as the ventricles contract. They contract with a whole lot of force, and you really, really need to reinforce those valves. All right, gang, so that's external and internal anatomy on our large heart model. We are going to switch over to our small heart model to really talk specifically about the coronary circulation.